Yeah, you're touching on something that I was thinking about asking, which is, strategies to reduce the frequency of cancellations. If it's something that becomes a bit of a habit for one of your patients, what is the appropriate next step to take as their mental health provider?
Is this a patient who's coming once a month or once every other month for a medication refill? Or is this a weekly or twice weekly therapy patient? There's different strategies depending on what type of patient it is, especially for therapy patients where, this field in general, people are uncomfortable talking about money. I think a lot of patients may not realize that when they don't show up, that is affecting the income of the provider that they're seeing. Therapy patients tend to get regular weekly hours assigned to them. And if you work with kids, like the afternoon hours are prime scheduling time, and it's very hard to take a hit having your 4 to 5 spot with someone who cancels a lot. What it means is healthy and good communication around figuring out anytime someone cancels or no-shows. One recent change that's been nice, Parker, is since the pandemic and telehealth becoming ubiquitous in this field and still being able to be reimbursed for, if a patient is late or forgets about an appointment, you can quickly get a video link out to them wherever they are and say, listen, let's do the session and you pay your copay, or don't do the session and you've got a large no-show fee to deal with, which we'll talk about cancellation or no-show fees, which also begs the question of what type of entity you are. So if you're like a solo practice and you have a patient who's not showing up, pretty quickly you want to try to reach them and you can try to make it a telehealth session, and then it saves the patient any no-show fee and lets you see them and do your billing. If you're working for a larger group as a clinician and your patient doesn't show up, there is a little incentive to get that 45 minutes or hour free to do what you want if that
Right.
doesn't directly affect your paycheck. So there are different strategies if you're managing a group versus, if you're a solo practice.